Hi, good evening, doctors. Welcome to the weekend wisdom shot. So, let's make this weekend a little productive. So, we are going to have a crisp topic of magnesium sulfate. So, the magnesium sulfate is one which is very important in the practice of obstetrics. All of us have a little confusion about how to load magnesium sulfate in cases of eclampsia. So, every time we read it, but we cannot remember it. Today I have come with you, I have come to you with a simple technique of how to remember, because it is a very crisis situation. This is an emergency situation where you have to act fast. At that point of time you cannot remember at what dilution you have to give. Is it 50%, is it 20%, or something like that? We have so many doubts in mind. So today, in this weekend wisdom shot, we are going to know how the magnesium sulfate is being loaded, at what dose it is to be given. Okay, yes. So coming to the magnesium sulfate, to the beginners, I want to tell you that this is the drug of choice for cases of eclampsia in the pregnant women. So what is the mechanism of action? This acts as a membrane stabilizer and neuroprotector, and this reduces the motor end plate sensitivity. So the most important two things we have to remember here, I have already highlighted. The first is the membrane stabilizer, and the second is it blocks the neuronal calcium influx, which is responsible for the seizures. It blocks it. Okay, it blocks the calcium influx. So let us have this 2-minute quick session about how to load and what is the regimens that we are going for the magnesium sulfate. So the two important regimens are IM regimen, that is intramuscular regimen, which is very popularly known as Pritchard regimen. Okay, it is very popularly known as Pritchard regimen. And the second IV regimen, that is Zuspan or Sibai regimen. So coming to the Pritchard regimen. So the Pritchard regimen, we have loading dose and the maintenance dose. The loading dose is given by IV 4 grams over 3 to 5 minutes, and this 4 gram is to be given as 20% solution. Okay, this 4 gram is given as 20% solution. Don't worry, I'll clear all your doubts about 20% and 50%. Don't worry. So the 4 grams is given as 20% solution IV, followed by 10 grams. This is given as 50%, that is deep IM 5 gram in each buttock. Okay, so each buttock you are giving 5 grams. So this is about the loading dose. Coming to the maintenance dose, you are going to give 5 grams IM 4 hourly in the alternate buttock. So this is about the Pritchard regimen. Coming to the Zuspan or Sibai regimen, you are giving it as only IV, that is a slow IV over 15 to 20 minutes. You are giving it as 4 to 6 grams, and then you are having an infusion of 1 to 2 gram per hour. So now let us concentrate on this. Let me zoom this in. So now you are able to see this, right? So this is the magnesium sulfate ampoule. So what it is given, each ml of magnesium sulfate is about 50%. W by V is weight by volume, that is 50%. Okay, magnesium sulfate concentration here it is given is 50%. Okay, just remember this one. And what we are seeing here, this is also a magnesium sulfate. This is 50%. Okay, 50% of concentration. And see this ml, 2 ml contains 1000 mg or 1 gram. Let us see what we are going to do here. So here you can see like 1 ampoule. Ampoule means a small one. So 1 ampoule contains 2 ml. Okay, 2 ml of the liquid magnesium sulfate. Okay, so this is 2 ml. 1 ampoule contains 2 ml. And in this, each ml contains what we have read previously. Okay, this 2 ml contains 1000 mg. It means each ml contains 500 milligrams. This means 2 ml contains 1 gram. 2 ml contains 1 gram, and it similarly means 1 ampoule contains 1 gram. Now just remember one thing, 1 ampoule contains 1 gram. 1 ampoule contains 1 gram of magnesium sulfate. 1 ampoule contains 1 gram of magnesium sulfate. Remember this thing for your lifetime. 1 ampoule contains 1 gram of magnesium sulfate. Restricted to the condition that most of the ampoules will contain 1 gram. You have to just check whether it contains the same or not when you are injecting it. That's it. But universally, 1 ampoule contains 1 gram of magnesium sulfate. Now, you are giving it IV. Okay, you want to give it IV. So what we have read, IV 4 gram of magnesium sulfate you are going to give. So 4 gram means how many ampoules? Yes, 4 gram means 4 ampoules of magnesium sulfate. So 4 ampoules of magnesium sulfate means what? 8 ml. Okay, 4 ampoules of magnesium sulfate means 1 ampoule is 2 ml. So 4 ampoules is 8 ml. Now the story is not over yet. This 4 gram is 20% magnesium sulfate. But what we are having in your hands, it is 50%. So how you are going to dilute? Take a 20 cc syringe. Okay, the maths is not needed for us. That's why I am telling you very crisply. Take a 20 cc syringe, load 4 ampoules of magnesium sulfate, then 8 cc is complete. So how much of cc of syringe is remaining? 12. So load this 12 ml with 0.9% NS. Okay, you can dilute this with 0.9% NS or 5% dextrose. So both of the things you can use. So this comes to 20. So 20 ml of magnesium sulfate, that is diluted. So the 50% is diluted to 20% sulfate. So as we have discussed, this is 4 grams of magnesium sulfate. So IV you are going to give 4 grams of magnesium sulfate. So 4 grams of magnesium sulfate means you have to load 4 ampoules. 4 ampoules means 8 ml. But the story is not over yet. So in 8 ml, this is, you have to give 20% magnesium sulfate, but you are having in your hand 50%. So you are going to dilute it. So how you are going to dilute? This 8 ml, you are adding another 12 ml of 0.9% sodium chloride, that is 0.9% NS, or you can add 5D, that is 5% dextrose. You can add this 5D also. So let's make it 20 cc. Okay, let's make it 20 cc. So this is a 20 cc syringe. In it you will be loading 8 ml magnesium sulfate, and the rest of the 12 ml you are loading it with the 0.9% saline, and overall it comes as a IV. Okay, overall it comes as a IV 4 grams of magnesium sulfate. Okay, percent now. Okay, easy. So I just want to revise you. 1 ampoule contains 2 ml. Each ml you 1 ampoule contains 2 ml. Each ml contains 500 mg. That means that 1 ampoule is 1 gram of magnesium sulfate. 1 ampoule is 1 gram of 50% magnesium sulfate. 1 ampoule is 1 gram. Then IV 4 grams. 4 grams means 4 ampoules. 4 ampoules is 8 ml. But you are going to dilute it. So take a 20 cc syringe. Load 4 ampoules of magnesium sulfate. It comes to 8 ml. The rest of the 12 ml you are going to dilute it with 0.9% NS. So this is 8 ml. Then the rest of the 12 ml you are going to load with NS. Clear? This is IV. And slowly you are going to give it like around 15 to 20 minutes. Next comes IM. IM is very easy because you are going to give it as 5 gram in each buttock. Okay, you are going to give it as 5 gram in each buttock. 5 gram means 1 ampoule 1 gram. 5 grams means 5 ampoules. 5 ampoules means 10 ml. Yes, 5 twos. 10 10 ml. It means one 10 ml syringe is enough, and another 5 grams in the other buttock. That is again 5 ampoules and 10 ml. You are not diluting it because 5 grams of 50% magnesium sulfate you are going to give IM, because IV you cannot give this strong dose, that's why you are diluting it. But in IM you can give 50% of magnesium sulfate, that's why no dilution is needed. Just simple 5 ampoules, 5 to 10 ml, so 10 cc syringe is needed. Just take a 10 cc syringe, load 5 ampoules, enough. 5 ampoules, 5 ampoules, give to both buttocks. So this is the loading dose. Easy. So just let me revise it. You are going to give IV. So whenever a patient comes with eclampsia, immediately go to your magnesium sulfate kit or eclampsia kit, take the airway, make the patient stable, call for help, and just turn the patient's head to the left side so that she might not have this aspiration because of falling backward of the tongue. So all this is okay, and you will assort your nurse and everything to call for help. Then immediately go to the eclampsia kit, take the ampoules, load, take a 20 cc syringe, load 4 ampoules, it comes to 8 ml, then use 12 ml of the NS, enough, leave it. So give it to IV, and then take 2 10 cc syringes, load 5 ampoules of magnesium sulfate, give it IM. It is a very fast decision you have to be, and this you should remember for your lifetime by heart, and within fraction of seconds it should be memorized by your spinal cord, not at the level of brain, because you don't have such time to go to the brain and ask like which ml is which gram, everything. No, just it should be your reflex, your spinal reflex, so immediately you have to act upon. So now crisply, what should be present in your kit? 14 ampoules of magnesium sulfate. So what are these 14 ampoules? 4 for IV, 5 for IM, one buttock, and 5 for IM, another buttock. 14 ampoules of magnesium sulfate. So 4 gram IV, 5 gram IM, and another 5 gram IM, and 120 cc syringe for IV, 2 10 cc syringes for IM. So this is all about how to load the magnesium sulfate. So how to monitor the patient on magnesium sulfate? So immediately after giving IV loading dose or IM, everything loading dose is completed, then you have to check for the pulse, blood pressure, respiratory rate, saturations. Every 10 to 30 minutes initially you have to check for, and you have to check for the temperature. Most importantly, about the deep tendon reflexes, you have to check every 4 hours you have to check, and the urine output also immediately after. Whenever you are giving the maintenance dose, empty the urine, empty the bag, and check for the deep tendon reflexes. Empty the bag, look for if the urine output is good or not, if it is more than 30 ml per hour or not, then you have to check it. And the fetal well-being also you have to check it, decide about the management, and decide about the decision of the delivery. Okay, this all you know, you just confuse about the doses and IV or IM. So these things you usually confuse. So this thing I have discussed very crisply. If you have any doubts, or if you want to discuss me further, you can ping me in the chat box or comment box. So if you like our videos, please have a like, and you can share with your friends, whoever is getting confused. So this is more important for the residents and interns also, who are working in the labor ward and in the obstetric section. So I hope you liked this class. The picture abhi baki hai, so the class is not over yet. We are going to discuss what are the toxicity features of magnesium sulfate in the next week, in the next weekend wisdom short. Yes, thank you for your patient hearing, and happy learning. Thank you.